You have likely heard the name Ozempic whispered in conversation, seen it mentioned in headlines, or perhaps even wondered if it is the secret behind a celebrity's recent transformation. It is important to start with the facts and understand what this medication truly is. Ozempic is the brand name for a medicine called semaglutide. Its primary, FDA-approved purpose is not for weight loss in the general public, but rather to help adults with type 2 diabetes manage their blood sugar levels. It belongs to a class of drugs known as GLP-1 receptor agonists, which represents a significant advancement in how we approach metabolic health and the complex systems that regulate our bodies. So, how does Ozempic actually work inside your body? Imagine your body has a communication system that tells your brain when you are full. Ozempic taps into this system by mimicking a natural hormone called glucagon-like peptide 1 or GLP-1. This hormone is normally released from your gut after you eat. By activating the same receptors as GLP-1, Ozempic sends powerful signals to your brain that you are satisfied, which can significantly reduce your appetite. It helps you feel fuller for a longer period after a meal, making it easier to consume fewer calories without feeling constant hunger pangs or deprivation. Another crucial action of Ozempic involves the digestive process itself. The medication slows down the rate at which your stomach empties its contents into the small intestine. This process, known as delayed gastric emptying, plays a vital role in its effectiveness. When food remains in your stomach for a longer duration, it contributes to that sustained feeling of fullness. This physiological change means you are less likely to overeat or snack between meals, providing a biological advantage in managing your caloric intake. This is a key reason why many people using the medication find their relationship with food begins to change in a fundamental way. It is absolutely essential to remember that Ozempic was first and foremost developed as a treatment for a serious medical condition, type 2 diabetes. Its ability to help control blood sugar is its core function. The weight loss that many patients experience was initially observed as a secondary benefit, a welcome side effect for individuals who often struggle with weight as part of their condition. This context is critical because it frames the medication not as a cosmetic solution, but as a powerful medical tool with specific intended uses, which should always be respected and managed under the guidance of a healthcare professional who understands your complete health profile. While Ozempic often gets the most media attention, it is part of a growing family of similar medications. It is important to know the key players to have a clear conversation with your doctor. The most direct comparison is with Wegovy. Interestingly, Wegovy and Ozempic contain the exact same active ingredient, semaglutide. The main difference lies in their FDA-approved uses and dosage. Wegovy is specifically approved for chronic weight management and is typically prescribed at a higher dose than Ozempic. Think of them as two different tools made from the same material but designed for slightly different jobs. One for diabetes management and the other for weight loss. Then we have another powerful medication you may have heard about called Mounjaro. Its active ingredient is tirzepatide. Mounjaro is a bit different because it is a dual-action agonist, meaning it mimics two different hormones involved in appetite and blood sugar regulation, GLP-1 and GIP, which stands for glucose-dependent insulinotropic polypeptide. This dual mechanism is shown in clinical trials to be exceptionally effective for both blood sugar control and weight loss. Just like Ozempic, Mounjaro is officially approved for treating type 2 diabetes, but it is often prescribed off-label by doctors for weight management due to its impressive results in this area. To make things even more specific, the same active ingredient in Mounjaro, tirzepatide, is also sold under another brand name, Zepbound. This is where it gets very similar to the Ozempic and Wegovy situation. While Mounjaro is the brand name for tirzepatide approved for diabetes, Zepbound is the brand name for tirzepatide that has been officially FDA approved specifically for chronic weight management. This distinction is important for insurance coverage and for ensuring patients are receiving the medication that is officially sanctioned for their particular health condition, whether it is primarily diabetes or obesity needing direct treatment. So, how do these medications help you lose weight? The primary mechanism for all of them is appetite suppression. By making you feel full and satisfied, they fundamentally change your relationship with food and hunger cues. This reduction in appetite naturally leads to a lower daily calorie intake, which is the cornerstone of weight loss. It's not a magic process that melts fat away on its own. Rather, it is a tool that assists you in adhering to a calorie-controlled diet. The medications give you a powerful biological upper hand in the fight against overeating, a struggle that many people find exhausting and difficult to win with willpower alone. The widespread discussion about these medications has been fueled by the stories of public figures who have used them. Oprah Winfrey, for example, has spoken about using a weight loss medication as a tool to manage her weight, viewing it as a gift to release herself from the shame she felt for decades. Similarly, Whoopi Goldberg shared that she used Mounjaro to lose significant weight, framing it as a health decision. These positive stories highlight how these drugs can be life-changing for individuals who have long struggled with their weight, offering them a new sense of control and well-being. However, the journey with these medications is not always smooth, and it is crucial to hear about the challenges as well. Actress and comedian Amy Schumer tried Ozempic but had to stop because the side effects, particularly severe nausea, made it impossible for her to function in her daily life as a mother. Sharon Osbourne also had a difficult experience, losing more weight than she intended and feeling unhealthily thin. Her story is a powerful reminder that the effects can be unpredictable and that more is not always better. These experiences underscore that individual responses to the same medication can vary dramatically. Beyond the varied results, there are common side effects that many users report. The most frequent are gastrointestinal issues like nausea, vomiting, diarrhea, and constipation. For most people, these side effects are mild and tend to decrease over time as their body adjusts to the medication. However, for some, like talk show host Stephen Fry, who experienced severe vomiting, these effects can be debilitating enough to warrant stopping the treatment altogether. It is a trade-off that each person, in consultation with their doctor, must carefully consider before starting their journey with these powerful drugs. There is also a significant concern about what happens when you stop taking the medication. Influencer Remy Bader shared her story of experiencing intense rebound binge eating after she stopped Ozempic, leading to her gaining back more weight than she had lost. This rebound effect is a major point of discussion among medical experts. Tracy Morgan also admitted to out-eating the drug's effects, showing that lifestyle habits remain critically important. These stories serve as a powerful cautionary tale. These medications are not a permanent cure, and without sustained lifestyle changes, the weight can easily return. It is absolutely vital to understand what doctors are saying about these powerful new medicines. Healthcare professionals emphasize that drugs like Ozempic, Wegovy, and Mounjaro are not a magic fix or a simple shortcut to weight loss. Instead, they should be viewed as one component of a comprehensive long-term health plan. This plan must include a balanced diet, regular physical activity, and behavioral changes. Using these medications without making foundational lifestyle adjustments is like trying to build a house on a weak foundation. It is simply not sustainable for lasting health and wellness in the long run. The reason medical supervision is non-negotiable is because these are potent prescriptions with potential risks. A doctor needs to evaluate your overall health, including your kidney and pancreas function, before determining if you are a suitable candidate. They also monitor your progress, manage side effects, and adjust your dosage as needed. Trying to obtain these drugs without a prescription or using unregulated compounded versions is incredibly dangerous. As Lottie Moss's scary experience with a seizure after an incorrect dose showed, improper use can lead to severe medical emergencies that can have devastating consequences. The debate around these drugs also brings up important social questions. On one hand, many people find them to be incredibly helpful tools that finally offer a solution after years of struggling. For individuals with obesity, which is a complex chronic disease, these medications can significantly improve health markers like blood pressure and cholesterol, reducing the risk of heart disease. Celebrities like Oprah have called for an end to the shame and judgment surrounding their use. On the other hand, critics like Jamila Jamil worry about the long-term unknown side effects and the potential for reinforcing unrealistic beauty standards. In conclusion, it is important to hold on to a few key takeaways. Ozempic and similar medications are powerful, effective tools for managing type 2 diabetes and in some forms for chronic weight management. They work by suppressing appetite and slowing digestion, but they are not without risks and side effects. They are not a magic wand and must be used under strict medical supervision as part of a larger commitment to a healthy lifestyle. The decision to use one of these drugs is a serious medical choice, one that requires a thoughtful and honest conversation between you and your doctor.